Hi, I'm Debbie Buckwalk, one of the directors on the ANPD Board of Directors, and welcome to our Facebook live stream of the 2020 Poster Award presentations. Moving ANPD's 2020 annual convention, Aspire to Envision, to a virtual format means the opportunity to bring the talent of our ANPD community in front of a larger audience, which is great. This year, more than 40 posters are available for viewing on ANPD's website. These posters demonstrate the great work that our colleagues are doing, and they provide the opportunity for you to discover best practices that you might want to bring right back to your organization and use right away. Today, I have the pleasure of introducing to you the 2020 award recipients. Each of our presenters will have 5 minutes to present their poster, just as they would have done in the exhibit hall of our convention. If you have questions, feel free to share them. And if the presenter can't answer them live during the allotted time, they will follow up with you. And we'll start today with the top poster selected by you. Voting for the Participants' Choice Award was open to the public until August 30th. The Participants' Choice Award winner is a poster entitled, Flipping the Script on Incivility in Healthcare, Modern Workplace Learning Techniques Enhance Behavior Change. Please welcome Jenny Harshman from Children's Medical Center, Dallas. Jenny?
Hi all, thank you so much for joining. So I want to share my poster by starting with a story. At Children's Health, the awesome clinical nurse specialist team organized a civility initiative. They used a validated pre and post survey, and we're going from department to department offering multidisciplinary training about civility practices. In an in-person session, they were reviewing excellent civility content. They were providing PowerPoint slides with pre and post data information. They had articles for the participants to read in the session, and then they were talking through some case studies to review application. After this initiative had been going on for a couple of months, they were seeing that they weren't getting those desired behavior changes. And so we all know how this story goes. Luckily, they reached out to our department and asked for some help to create a learning experience around the civility initiative. So I knew that the I knew that the CNS group was going to continue to own this initiative. So I started thinking about how to drive outcomes through different education delivery methods that were sustainable and easy to facilitate. So really the purpose was to engage the learner through different modern learning techniques to see if changing the teaching methods and learning opportunities could lead to the behavior change in civility practices. So I knew that creating a healthy work environment is dependent on behavior change. So I looked at different opportunities to practice, to comprehend material, and then to apply in the learning setting. There's that affective, cognitive, and psychomotor aspect to civility behaviors, and I worked to fit in every single one of those aspects into the training. So I started by flipping the learning environment, something we're all getting a lot of practice with in this COVID environment. I used all of that great civility knowledge-based content that the CNS group had already found, and I worked with an instructional designer to create an interactive computer-based training module. So this training module was to be completed before the in-person session. So yes, in that, we reviewed general civility content, used knowledge checks to verify. We also put in some reflection questions, allowing the learner to really think about how they felt about incivility. Videos were also used to explore the emotional side of incivility. As you look at my poster later, I did add a QR code to the video that still gives me goosebumps every time I watch it, so I encourage you to check that out. As well as the videos, we talked about the overview of the civility initiative, how it would look in their department, and gave them an opportunity to see what's expected of them and this push towards civility in their departments to really gain their ownership into the process. The computer-based training was not role specific, nor was it clinical focused only, so that the CNS group could continue using it moving forward as they move through the organization. I then started looking at reformatting those in-person sessions. We still shared the pre-survey information from the department, but we also added a video message from the senior leaders of that clinical area, really showing the leader support of this initiative. The majority of the class was focused on application, practice, and discussion. Instead of using case studies to just be discussed and read, we created scenarios that the unit leadership actually created from experience, and we used role-playing and immediate feedback for practice. We also provided different discussion questions, which prompted sharing and social learning in a nice, safe, small group environment. At the end of the session, the participant left having practiced those difficult communication techniques, which built on the civility content that they learned through the computer-based training. Also on my poster, you'll see that there's a QR code to the flipbook that has some examples of some of the scenarios that we used. So you'll see that they are very multidisciplinary and could be applied in really any clinical setting through the healthcare system. So our immediate feedback, the L1 we used, showed 96% of the participants plan to make changes to their professional behavior because of what they learned, which that's super exciting. Great to see an L1 feedback, so great. But it was really those long-term changes that I was most excited about. So the post survey, which was done 6 months after the in-person session, is where we saw the biggest changes. So they asked a number of different questions. So on the question of, have you been bullied? The number of people who answered yes decreased by 21%. To the question, have your opinions been ignored? The number of people who answered yes decreased by 40%. To the question, have you been ignored or excluded? The number of people who answered yes decreased by 46%. And has there been gossip or rumors spread about you? The number of people who said yes to this question decreased by 56%. These were the behavior changes we were looking for with the initiative. And it was so exciting to see that by having application opportunities, we were able to start those behavior changes. As a bonus, the new education program I helped to create decreased the cost of education by 50% per learner. So throughout the creation of this education program, I was also creating a toolkit for other clinical educators in my department to use as a civility initiative came through the organization. This toolkit creates consistency in the way that the education is provided and allows for sustainability of the program without direct ownership by NPD. I am now a member of the Civility Steering Committee, which is awesome. And still, even 2 years later, we're seeing that those modern learning techniques have continued to enhance behavior change from this civility initiative. Thank you so much. Are there any questions?
Jenny, this is Debbie, and I'm not seeing any questions, but wow, what an important topic. I just appreciate how you touched all the domains of learning and you leveraged all of those various teaching methodologies. And not only that, you gave us bonus material through QR codes, which is super cool. So thank you for that. Your outcomes are great. And I really applaud you and say kudos to you for measuring those level 3 and level 4 outcomes, and then a cost savings to boot. So no wonder the People's or Participant Choice Award, got to you. That's just amazing.
Thank you so much.
Thank you so much for sharing that great work.
Thank you.
We'll watch for questions that come in, and we can always capture them later as well. Thank you. All right, our next poster awards were determined by the Convention Content Planning Committee. Each poster was reviewed and scored by at least 3 judges using rigorous criteria. The 3rd place poster award recipient is Holly Etling and Michelle Weaver of Akron Children's Hospital. Please welcome them to present their poster On the Horizon, Envisioning a New Role for the NPD Practitioner.
Hello, and thank you for that welcome. What an honor it is to be selected as a winner. I've been to the last 2 conferences, and I've always come away just so inspired and grateful for this community. So I wish that we could be there in person having these conversations, but grateful to still have this platform to share our work. So you can see our poster on the screen, but I'd like to set the stage for our poster by stepping back in time a few months to February, the end of February, and you're going about your daily NPD work. You're working with Orients, you're creating and planning your education. Maybe you're getting your plans lined up to attend the ANPD conference in the spring. And then March comes and COVID comes and hits the scene. Perhaps your environmental scanning tuned you in, or perhaps you were caught completely off guard. But suddenly priorities are shifting and the focus turns to PPE conservation measures and the possible rapid influx of patients that we're going to need to prepare for. So yesterday you were sending out email reminders to staff who didn't complete their monthly education. And today you are identified as part of a team tasked with preparing the masses on how to safely work with limited PPE and preparing pediatric nurses in our organization to potentially care for adult COVID-19 patients. So how did you and your organization respond to this challenge? What types of challenges did you face with rapidly disseminating this information? Did you have the tools and the internal relationships lined up and in place to quickly build and deploy education to staff? So our poster describes how our organization leverages NPD practitioners in a unique role, one as instructional designers and LMS administrators, to help meet that growing demand for effective, engaging online education and act as a bridge between the NPD practitioners in our organization and the organizational development team, which is housed in human resources. So I'm going to toss the mic over to my colleague, Michelle, who's going to continue walking us through our poster and our journey.
Yes. Hi, I'm Michelle Weber. And again, thank you so much for this warm welcome. We are so excited to be here. And I'm going to share a story that helps us understand more of the background and how did our organization really position itself to be successful in these uncertain times. It started back in 2016, and our organizational leadership thought we could do better. We could be more strategic in our educational endeavors, be more creative and innovative in our approach, and be connected across all of the divisions. I stepped into my role and found that we were great at providing content to our nurses, lots of content that they had to read. And I started to think about how, as a nurse myself, how did I learn best? And it really wasn't from reading. I like to apply what I've learned, really experience it. And if I could do that, then I tended to remember it and I could put it into my practice. So began our journey to reinvent the way that we presented content in an online learning environment. Our NPD team are expert learning facilitators, leaders, mentors, but where that gap existed was translating that knowledge into a learning management authoring tool and a platform. So our role is to help our team reimagine and open new and exciting possibilities and have a great deal of fun while we do it. We have so much fun. We have, I think, one of the most fun jobs. Fast forward 4 years, and we are now deeply connected with our organization's ERP system, especially the LMS. And this current pandemic has exemplified the value of the NPD role that we can really bring. And we've been able to quickly create and curate high quality education for the masses and then deploy it efficiently by leveraging the LMS to its full capacity. So if you are thinking this may be a role your organization needs, then I'm going to encourage you to find someone that loves a challenge, that is an innovator and really values making those connections. I think the collaborative piece of our role has been essential to our success. And of course, we would love to hear from you if you would like more information, or if you're a fellow NPD practitioner living in the LMS world, definitely connect with us because we would love to hear about your experience.
Great. Thank you so much. I'm looking to the chat. Not sure we have questions. A little hard to see with all this technology we're working on here. But I just want to say thank you, of course, to you, Holly, and to you, Michelle. I love that you use storytelling to invite us into your poster. I mean, what a powerful tool that we have at our disposal as NPD practitioners is storytelling. And you're right. from February until March, it just seemed like you went through this twilight zone and you jumped into one dimension to another of our routine work into just the chaos that really we all experience. So just being able to use a virtual platform and making sure it's engaging and people can understand what they need to know and participate is so important. And I'm so glad that you are representing ANPD and NPD practitioners in that learning space. So thank you so much for your poster and your presentation. What LMS do you use? There is a question. What LMS
yes.
do you use?
We are currently on Infor My Learning System. So Infor is our greater ERP system, our enterprise resource planning solutions.
Great, thank you for that. Well, that was a great poster. It's hard to keep going, but we've got more. We've got a couple more to go. So second place is awarded to the poster Aspire to Envision, Preparedness for Veteran-Centric Care Now and in the Future, some future thinking there. Congratulations and welcome to Mary Volenec of SCL Health Lutheran Medical Center and Kelly Watson of Lutheran Hospice. Tell us about your poster.
Hi, and thank you so much for having us here today. My name is Dr. Mary Volenec, and my partner Kelly Watson and I worked with the Lutheran Hospice in the within the SCL Health System, which is in Wheat Ridge, Colorado, to bring to them the We Honor Veterans program. We want to thank the ANPD Board of Directors and program planners and so forth for having this forum. It's so fun to present our posters, especially this way. So Kelly and I worked together on this program evaluation because we used an existing program called We Honor Veterans to help our hospice staff be more prepared to care for veterans who come to us for their end-of-life care. I could talk for about a year, but what I'm going to do is turn it over to Kelly to give us a little bit of introductory information. Kelly?
Hi, this is Kelly. We started with the teaching materials that were provided by the We Honor Veterans program, which is run by the National Hospice and Palliative Care Organization, and found that it didn't meet the needs of our staff exactly as it was. The PowerPoints were really intense verbiage on them, and it was not a really good interactive style. So we looked at what do our staff need to know or want to know to feel prepared to take care of veterans. The studies were showing us that people don't usually get cultural competency training, or nurses specifically don't get cultural competency training in caring for veterans. So we wanted to address that and find out how our staff felt. And when we polled them, we came up with the same types of deficits that we're seeing in the literature. So we started, what do we do? So we thought, well, let's look at the things, what is cultural competence for veterans? So we found a really wonderful program that was a 15-minute video that talks from the veteran standpoint, what is it that veterans want us to know about being a veteran? And that worked really well with staff. We used that as a nursing cultural competency for the year of 2018 and 2019. And then in 2020, we expanded that out into the rest of the staff. The people that we were serving, most people get to teach nurses only. In hospice, it's interprofessional. So we had nursing assistants, nurses, social workers, chaplains, and then all of our support staff, the people that work in the office, the people that answer the phone when we get referrals, all the people that make up our hospice, so about 120 staff we were working with. We started with monthly lunch and learn or brunch and learn type things. We found that providing food for people was a great lure to get them to come to a training. They would come if we offered them a bite to eat, so it wasn't wasting their time, so they could do something that they do anyway and they could learn at the same time. We brought in veterans to talk directly to them. They'd present their topic and then they were there hands-on to answer questions or to give real-life examples of what they were speaking about. We also developed modules that we put online. We combined some of what we had taught during the courses, the brunch and learn and lunch and learn, and Mary put those together into PowerPoints that we used on our learning platform, which is HealthStream. So those were not interactive, but they were individualized for each of the staff, and we made that a voluntary issue for them. They could take it or not take it, but those who did were entered into a drawing, and Mary used the really nice picnic basket for the winter, and that got lots of people using it. And Mary, well, you'll see that big spike in the middle of the poster. That's when we had people competing for the picnic basket.
Yeah, and the picnic basket wasn't just this kind of off-the-cuff idea. I really needed data, and I couldn't get people to engage. Everybody was so busy doing this thing called work, right? And so we had everyone who did a module on our learning management system, which is HealthStream, they were entered into a drawing. And so that was kind of a fun way to do that. It was right around the 4th of July. We made a very patriotic basket. Our results of all of these activities, which took over a year, and we had, you know, tons of interactive stuff, and we talked about it at every single staff meeting, every single gathering, every single everything. We increased preparedness from 46% of staff prior to this project and program implementation felt that they were prepared to adequately care for veterans at the end of life. At the end of our project, we had a 90% preparedness rate, which was wonderful. What we really want you guys to take away from this is that you can use an existing program to build a wonderfully tailored learning system for your for changing the culture within your workspace. And we earned 3 out of 5 stars of national recognition with Lutheran Hospice. And gosh, if you have any questions, I'd love to hear them.
Thank you, guys. There was one question about whether or not you connected with, I believe it was veterans in Aurora, Colorado. Were you able to connect with them?
Absolutely.
We sure did.
Go ahead, Kelly.
Yeah, we connected both at the VA, and then there's a wonderful group, because it's a hospice program. The Denver Hospice has been doing this since they started the We Honor Veterans program almost 20 years ago. And there's a whole coordinated effort across all of the Denver metro area and all throughout the state. And we connected with those groups as well. It was that was part of, I think for us, the most fun part was getting to interact with all of the other groups. And in most hospices, the person leading these education initiatives is somebody called a volunteer coordinator. It wasn't run by educators or professional development people. And so Mary and I got to do a lot of extra guest teaching at different facilities and different organizations. That was a wonderful experience.
Yes, and we were able to take staff from volunteers all the way through our physicians with us into the community for these get-togethers. It was really, really insightful.
That is great. You know, I really appreciate you sharing the information, Mary and Kelly, about the We Honor Veterans program. And, you know, NPD practitioners are so resourceful. You go out and you find an evidence-based program, and then you say, you know, how can we leverage that? How can we repurpose that? And I just really applaud you for doing that. And hospice care is such an important topic, and then merging it with the unique needs of veterans is just amazing. I love that you include the entire team, because it takes a village in healthcare. So I really appreciate that. And I did see a chat pop up saying that food is helpful. That's one of our secret tricks of the trade. So I'm glad you're able to do that. And I love the spike when you had the prize drawing. I love to see that data correlation there with the prize drawing and the spike. And I was really,
people love
yeah,
And I
really
think,
go ahead.
Can we, yeah, the video that we used was through the Psych Armor Institute. It's called 15 Things That Veterans Wish You Knew. That one's great. It's free, and that one works really well. Let's see. Our contact information is on the poster. Are the posters going to be available? Somebody's asking. That would be for you, Debbie.
Yes, the posters are available on the convention website, so you're welcome to go check those out. First, this is on our Facebook live stream, and so they'll be there for a while too. You'll be able to see the contact information. Such a great poster, and sharing the video. And then I was really struck by the fact that you had veterans come to the actual training event. I mean, touching the affective domain that way is just brilliant. I thought that was awesome. Of course, your outcomes were great. 46% feeling prepared before the educational intervention, and then 90% after. So kudos to you guys. Yes, big kudos to you for that great work. Thank you. And thank you for sharing your poster with us today.
Thank you.
And absolutely. And now finally to our first place poster winner, Maureen Lugod. And she's from Rush Copley Medical Center. Her poster is a non-traditional approach, a hybrid competency evaluation for emergency nurses. Maureen, tell us about your poster.
Hello, everyone. I'm humbled, I'm honored, and extremely grateful that I'm here in front of you presenting my poster. So why am I calling it non-traditional approach? Well, because it has been a practice in our institution to carry out a traditional annual competency day where clinical staff signs up for one session of 2.5 or 3 hours of skills validation activities. At the end of this one session, all the required skills are signed off and the staff doesn't have to think about it until the following year. So how did this all begin? Well, I'd like to give credit to my NPD practitioner friends within my organization, you know who you are, who, after our journal club, ventured and instituted an on-demand competencies over a period of several months in our med-surg and ortho units. In doing so, they were able to save our institution over $7,000 jointly. So during one of our department meetings, they posed a question, who's up for the challenge? So I didn't make eye contact at all being in the emergency department, but you know, it's saving money. So I did take on the challenge. So how did I do it? Well, first and foremost, I formulated my PICO question and goals so that I know what I'm measuring. The PICO question was among the ED nurses at Rush Copley Medical Center's main campus, does the implementation of a unit-based hybrid competency evaluation compared to the traditional scheduled annual competency day impact ED nurse engagement and cost during fiscal year 2019? My goals were promote nurse ownership and accountability, encourage autonomy, and achieve cost savings. I utilized the PDSA method, and I used Kurt Lewin's 3 stages of change as my theoretical framework. My measures were staff ownership and accountability, their perception of their own autonomy, and cost effectiveness. So the process, the ER nurses, they were given a time frame of 9 weeks, not several months. I only did it for 9 weeks, to do the skills validation on their own time while working. They were given choices for the method of verification, which ranged from chart audit, observation of daily work, QI monitors, case studies, and mock events. Do these sound familiar? We heard her during our opening session, right? Ms. Donna Wright's competency evaluation framework. So if they chose evidence of daily work, then a validator should be watching them, making sure that the expected steps were performed. As an example, the ER nurse came up to me so that I can watch her perform defibrillation during an actual code blue in real time. Of course, this was prior to the patient arrival. So where does the hybrid come in place? And this is where it is during my in situ simulation. I had to organize a mock event because of the nurses who may not be able to complete competency sign-off in real time. Because we're emergency department and our several accreditation, I had to make sure that I address regulatory requirements as well as our high risk, low volume items. So I scheduled several sessions ahead of time and listed them in their packet, giving them options whether they would want to do it in real time or during the in situ simulation. Well, I learned a lot from these mock events. The positive aspect was that the staff was in their actual environment. They know where to get the crash cart. They know where to get the color-coded cards for our pediatric patients. And they were able to do actual hands-on and opening those cards. They were in their safe environments, and so they were comfortable. The negative aspects, as much as I planned to be organized, I couldn't control the traffic. I couldn't control the staff coming in or leaving because of the workflow of the department. I also wasn't able to assess team dynamics, especially when it was one-to-one simulation. There was also a time when the infant warmer and my color-coded cards were taken away because of a sick infant. And then I had to give up my room because the waiting room was getting full. So the results. As NPD practitioners, one of our highlights was one of the core of our job existence is the completion of competency evaluation. So my heart kind of sank when I realized that there was a decrease in the completion of competency evaluation compared to fiscal year 2018. It dropped to 76%. At the end of it, I also conducted survey wondering what the nurse thought about the new process. I assessed their perception of accountability, which 80% said that they did have accountability. And then as well as their autonomy, they felt they were autonomous in choosing what they want to do for their competency evaluation. I also did a survey about their preferred process, and 52% of them chose annual competency day compared to the hybrid. Finally, the outcome is the cost effectiveness. We saved our institution 122 hours of nursing salary hours, which equated to $4,880 based on RN median salary for fiscal year 2019. I think as an implication, one thing that I want to point out as NPD practitioners, and I heard it from Michelle earlier, is being up to the challenge. If I didn't take on this challenge, I wouldn't be here in front of you talking to you about this. So let's keep taking that challenge and keep innovating. And most importantly, let's measure outcomes because we really need to prove our worth, especially at this day and age. I'm fortunate that my institution is really advocating for us and really trust us with our decision making and supporting us, whether it's financially or just moral support that we all need time to time. Thank you.
Thank you, Maureen. Wow, what a great presentation. I really loved how you partnered with staff. You mentioned journal clubs, really important things that we need to think about in our practice. And I think one of the hallmarks and one of the areas of joy I get is saving our organization's money. Yes. And you're right, that money speaks volumes, right? So we want to have a good return on investment for the organization, whether it be selecting the most effective teaching methodologies or competency assessment methodologies, or even saying, education is not the best intervention right now. And so we're going to lead you a different way and then saving money that way. So impressive 122 hours of cost savings. I love how you put the work into a 9-week time frame. I think that sometimes having too much time is kind of an enemy for us. I really appreciate too that you leveraged the different competency assessment methodologies. Adults love to have a choice, and so I appreciate that you did that. And I appreciate you just being real with us, sharing those challenges that you faced, and we all have them too. And that's how we learn as well. So great presentation. I didn't see any chat questions come in. Again, they can come in after today, and any of our presenters are happy to follow up with you. So I would, I see someone come up. Why did staff prefer the traditional model? Maureen, can you speak to that?
Well, during my survey, of course, I left a space for comments, and some of them said that they were uncomfortable leaving their patients to another nurse to complete the competency. And then another one also said it just made it felt like they were doing it forever. So I think it's different personalities. So I'm thinking one of those may be those who fell into the 76% who really wanted to get things done.
Great. Thank you for that. Thank you for answering that question.
Thank you.
Well, it looks like we're almost out of time here. I want to say a big thank you to Jenny, Holly, Michelle, Mary, Kelly, and Maureen, as well as everyone who did a poster, who authored a poster for our 2020 convention. And I want to thank you for tuning in to our Facebook live stream. This recording will be available on ANPD's YouTube channel as well. And I want to invite you to join us tomorrow for our 4th and final day of Aspire to Envision Virtual. Thank you all, and happy NPD Week.